Iceberg model of culture. While cultural competence acknowledges that some generalizations may be made about a culture, like an iceberg, the observable traits of someone's culture comprise only 10% of their actual cultural composition. Since culture influences how people think, behave, interact, make decisions, approach work and family, and deal with authority, this means that the strongest, most deeply held influences of those with whom we interact, the other 90% of each individual, may not even be perceivable. It means believing that each person you encounter comes with a unique set of experiences, characteristics, and beliefs that inform who they are and how they approach life, work, and health. It means relying on other stories about their experiences and believing them. One of my close friends at work identifies as gender non-binary and wants to be referred to with the pronouns they, them, or theirs. Co-workers, however, continue to use pronouns such as she or her. My friend is afraid to say anything about it for fear of being seen as a troublemaker. And now I'd like to introduce Evelyn Jones, who will be presenting the next part of this module.
Thank you, Laura. A changing cultural landscape. By the time the 2020 census is conducted in the United States, more than half of the nation's children will belong to what has traditionally been classified as a minority race or ethnic group. Despite this, significant health disparities exist in the delivery of care to individuals who don't appear to fit into the majority population. African American women with breast cancer are 67% more likely to die from the disease than are white women. Hispanic and African American youth are substantially more likely to die from diabetes than white youth. African American, Hispanic, and female physicians are more likely to provide care to the poor and those on Medicaid. Cultural misunderstanding is a major source for disparities in healthcare. This misunderstanding has many causes, but the main issue is the assumption of whiteness, heterosexuality, and maleness as the standard. According to a study published by Harvard Business Review in 2017, even when women employees have the same amount of mentorship, the same level of accomplishments, same level of seniority, same access to leadership, and exhibit similar behaviors at work, women are treated differently in terms of promotion and pay. The analysts who examined the data from this study concluded that gender inequality is due to bias, not to differences in the way men and women behave. Women of color are far more likely to be asked by work colleagues to do the housekeeping type functions of the workplace, from taking notes to ordering food to organizing meeting times, regardless of their status, level of education, or position within the organization. If they don't comply with this extra level of work burden, they tend to be stereotyped as angry Black women. But if they do comply, they reinforce the stereotype that their proper place is handling minor administrative details rather than driving important decisions. Cultural factors such as language barriers, fear of stigma on the part of lesbian, gay, bisexual, and transgender individuals, concerns about immigration status, physical or psychological challenges to accessing health care, lack of familiarity with the culture in and around a large academic medical center, and the relative comfort with speaking one's mind can play significant roles in determining the outcome of interactions between colleagues and between healthcare providers and patients. Those who do not fall into traditionally majority groups, such as white, male, middle class, heterosexual, American, are likely to be unconsciously identified as other and receive different treatment. First-generation medical students often face challenges that other students can't even imagine, from financial challenges to a lack of understanding of medical culture or the assumption of support that come with a position of economic privilege. So what do we do? When it comes to healthcare, increased cultural competence in patient interactions results in greater satisfaction with the delivery of care, better adherence to treatments, effective interaction, and improved health outcomes.